Okay, now over to South Korea. The country said the coronavirus is under control now, but there's a possibility of it returning in the winter. That and more news from our EBC correspondent in Seoul, Christine Jewel Uy. Hello, Christine.
Hello, Alma. Yes, South
Hi.
Korea seems to have under control the COVID-19, reporting only 13 new infections today.
Good.
But according to the chief of the Korea Centers for Disease Control and Prevention, or KCDC, Jong Eun-kyung, there is a possibility that the virus could come and go for the long term or a number of years. She also said the virus is likely to re-emerge in the winter season and may cause a wave as people tend to stay in close quarters at that time of the year because of too much cold. With the new patients, 7 are from overseas and 6 domestic. The country's total number of COVID 19 cases rose to 10,674, while 2 more people died, putting the death toll at 236 as of Monday at 12:01 a.m. Among the newly diagnosed patients, 2 were from Gyeonggi Province, 2 from Busan, 1 from Incheon, and 1 from Daegu. The country had zero record from Seoul, which is for the first time since early March. According to Jong, there were no confirmed cases in Seoul means that the overall danger of transmission has decreased, largely because of the municipality's efforts in virus testing. An eased social distancing campaign that allows the resumption of services at the country's 4 most frequently used facilities, such as religious facilities, after school private academies, bars, and gyms, provided that they adhere to virus prevention guidelines, is to take effect until May 5. And also, Alma, President Moon Jae-in orders economic team to draw up creative special COVID-19 measures. In a meeting with his top aides on Monday, the president said that the casualties and socioeconomic damage from the pandemic could be likened to that of a Third World War. Also, Moon said that South Korea can be the country that overcomes the crisis the fastest through solidarity and cooperation. He also hopes that the country can become the global standard in quarantine and economic measures. While the president noted that there are fewer new cases of COVID 19, he also said that it's too early for people to let their guard down, calling for cooperation and practicing social distancing. He also added that the results of last week's general election reflect people's desire to come together and overcome the crisis. President Moon also asked for cooperation from the National Assembly to help the country get through the situation while pledging to listen to the opposition parties. Back to you, Alma.
All right. Christine, kumusta na kayo dyan sa South Korea? How is it looking now? Back to normal na ba or malayo pa din sa ano? Like how it
South
was?
Korea is doing well po.
Mhm.
And then, yeah, the enhanced social distancing was like adjusted or extended up to May 5. But after that, they already said that I think the students can already go back to school provided that they do the precautionary measures like the schools should have thermal scanners, so all the students that will be coming in were still in control, so they will be tested for their temperatures first and they have to wear the mask, otherwise
Mhm.
they cannot enter the school, and at the same time they have to use sanitizers outside, and
Mhm.
the sanitizer should also be like inside the campus. And for other, like, the workers are still like working, all the
Mhm.
workers can work freely normally every day. But
Okay.
yeah, for when it comes to the even the church activities can also be go back to normal situation after May 5, provided that they have to follow the restrictive measures that the government will impose.
Okay. Those restrictive measures will still impose the social distancing
Yes,
rules.
that's right. Yeah, so the number of people, like for example, for a worship service for the church, the number of people that should go inside a church, or yeah, whatever they call this, it should be controlled.
Okay. So that
Yes.
number would be revealed on May 5.
Yes, that's right. But and then if they found out that you did not follow the restrictive measures and found some infections, probably it can have some kind of changes again with the rules. And those institutions or organizations that did not follow can be sanctioned and pay a fine.
Oh, is that how that's how strict is no, South Korea over there with their implemented guidelines? Like,
Yeah, they are kind of strict, and sometimes every weekends, which especially we know that Sundays is the common like church day for like everywhere in the world.
mhm.
So normally there will be policemen who are like rotating to have a duties in every places. So they really check, especially the churches, if they open, and then if they caught some church activities during Sundays or even like on a normal day, they will right away caught the attention, and then they will ask the church or organization to pay a fine.
Oh, what about what do you call this? I was asking earlier. Is what about your groceries, your supplies? Are there enough supplies now? There's no panic buying now. Is it back to
Yes,
normal?
we never had this panic buying, and also
You never
when
had it?
it comes
Okay.
to yeah, and when the COVID cases were just starting, like
Mm-hmm.
December, late
Mm-hmm.
December and early January, actually there were already like free sanitizers and free face mask in public utility vehicles, like in the bus and also
Mm-hmm.
in the subway. So whenever you like ride a bus or enter the subway station, you can just freely get some mask outside and freely use the sanitizers. And at the same time, but because of the high demand of the face mask, it just so happened that there were these times last February that we were having a shortage. Like if you want to buy, you have to wait for about a month for you to have to buy one box of face mask. And
Wow.
sometimes if you have to buy, the price is really like more than like double, more than double the price of the original.
Uh-huh.
So what happened during that time was the government found a way
Mm.
to solve this problem. So every week, you can get an a normal like rate of mask in the pharmacies, provided that yeah, you just have to line up in the pharmacy everywhere in South Korea, but you have to wait for a long line.
But there is
But yeah,
supply.
but there is a supply during that time.
What about testing? I've been reading about your you were one of the first to do the drive-by, drive-through testing. Is it still being done over there in South Korea?
Yes,
Have you
that's
seen
right.
it
And
yet?
actually, their response is very fast.
Oh.
If a person has like symptoms like just fever or cough or anything,
Mm-hmm.
and then you get you have to they have a hotline wherein we can report those cases. So
Mm-hmm.
if you call the hotline, the ambulance will right away go in front of your house and then pick
Oh.
you up, and then right away bring you to the hospital for testing. So right away, whether you were infected or not, they will like tell you whether you need to do a personal quarantine inside your house or
Uh-huh.
something. And then if they advise you to do a personal quarantine inside your house, they will supply food for you like 3 times a day.
Oh.
Yeah.
Wow, that's great. But what if so if an ambulance gets you, picks you up,
Yeah.
is it
Mhm.
okay if you don't go with them or you're forced to go with them or you're
No, you
supposed to
have
go
to
with
go
them?
with them. Yeah,
Really, you're
because
supposed to go with them.
yeah, I have
What happened?
I
Yeah.
experienced one time that I went to a cafeteria, in a public cafeteria in a school,
Uh-huh.
and then there was this one student who tried to enter. So before you enter in a in the cafeteria, they will test your temperature.
Oh,
So the student happened to have a fever.
okay.
So they tested many times, so like 3 or 5 times. She really has a fever. So they called the hotline, and then an ambulance right away pick her up, and then she cannot really like go everywhere. She has to stay there on
Uh-huh.
the information, yeah, besides the temperature like control system, and then
Yeah.
she right away ride the ambulance, and then yeah, then right away be
Taken to
tested.
the hospital. Oh,
Yes. Hmm.
so that's how fast South Korea is. Very efficient.
Yeah, so that's why even if you have the symptoms, you will not be like reluctant to go to hospital to be tested, because anyway they will support you. And even though you were hospitalized for COVID, it's yeah, it's covered by the insurance, so you don't have to worry even for the price of being hospitalized
Uh-huh.
because of that. Yeah.
So it's free. What about our Filipino friends there? How in
Yeah,
case
so
just
far,
yeah.
yeah, I just had news like several, I think 1 month ago, that there was the first Filipino, because the Philippine Embassy released a statement that there is already first Filipino who got infected with the virus. So the Filipino came from Europe to attend a seminar, and then when he gets back to South Korea, he was tested positive. But yeah, there were no reported cases after that, and then that Filipino recovered.
Oh,
So
thank
yeah.
goodness. All right. Thank you very much, Christine, for all your updates.